Years back, it was different. Hospitals were virtually empty. But due to the introduction of the free medical facility in the country, peripheral health units can no longer withstand the blossoming crowd of patients who go for treatment to these facilities. But perhaps the most noteworthy barrier to health services in Sierra Leone is cost. Out-of-pocket expenditures as a proportion of all health amenities. According to the National Health Sector Strategic Plan 2017 to 2021, expenditures are extremely high at 61%. Although new health facilities are currently being built across Sierra Leone, poor quality of services and accessibility still remain significantly disturbing. But the Chief Community Health Officer, Ministry of Health and Sanitation, Dr. Abu CONTEH, told me otherwise.
And benefit to healthcare in Sierra Leone, to some extent, is very good. I would definitely categorically say so, because even coming to talk about the free healthcare service currently we are talking about, I want to assure you every chiefdom in Sierra Leone is served. Drugs are provided in those facilities I'm talking to you about for mothers, children, pregnant women.
And just a few kilometers from Dr. CONTEH's office here at New England lies the newly built masterpiece 3-story modern King Haman Road Government Hospital, largely catering for pregnant women, suckling mothers and babies. The hospital consists of several departments ranging from blood bank to an ultra-modern surgical theater. My colleague Daphne Zainab Kamara made a tour of the facility and discovered an admirable treasure trove of medical equipment and facilities.
The labor ward is the actual point where we are.
However, all is not quite settled just yet. There is something still missing.
The recommendation is that we have a transformer, dedicated transformer in the facility, because the domestic line cannot accommodate all the equipment and all that we have now. So what they've done is to connect us to the domestic line while they process the transformer.
If completed, so many babies and pregnant women will benefit from its facilities, thereby significantly contributing to the health sector.
CONTEH Hospital over the years has been the biggest, if I should say, government facility that cater for patients in Freetown. Over the years, the population in Freetown has drastically overgrown. As a result, the hospital gets quite an astonishing, overwhelming number of patients who do come here on a daily basis for treatment. As a result, facilities here are scarcely insufficient to take care of this emerging number of patients, coupled with the fact that they are stranded with limited staff, doctors and nurses to take care of these patients.
But you can get to 400 at some time if you want to look at everybody that is coming into CONTEH as a patient or somebody that is coming for general services in the hospital. The drugs come in regularly, as it's often posted in the media, but definitely they do not cover all the patients that are coming in. You know, it's a fluctuating number. We do not just cater for people even just within the catchment of Freetown. We get a lot of referrals coming from the districts. Here is a tertiary hospital, and we have to accept anyone that walks in for treatment, whether a person is in Freetown or not. So you find out, especially the group of the free health care, those that are getting free care services.
It is quite an astonishingly high number of patients just for a single day. And as you would imagine, not all of them could be attended to, coupled with the painful reality of drug insufficiency. But that's not all. There is another equally disturbing situation. Many say the rate at which patients die at CONTEH Hospital has been worryingly threatening.
The PHU, peripheral health units, throughout Sierra Leone, we have 3 referral systems. We have primary, from the primary they refer to secondary, secondary to tertiary. So the PHU, cases that they can't man well, they refer them to the secondary hospitals, which are the district hospital. When they refer them there, If they find out that they are unable to take care of that patient, they also will refer the patient to tertiary hospital. So if you check the referral system from PHU to district hospital, from district hospital to here, the patient might have gone through a lot. The illness might have been so severe. So when they find out that they can't handle those cases, they send them to CONTEH. What can we do? We'll try our level best, maybe, but in the end, the patient sometimes pass off. At the end of the day, people will say patients are dying in CONTEH.
Amidst the significant progresses being made in the health sector, survival is still a bottleneck task. How hopeful should everyone be on the health sector when population growth is a continuingly preying issue? A similar situation is prevalent here at the Oladuring Children's Hospital. The hospital was built in 1961 and caters for children, as the name implies. According to the medical superintendent, Oladuring Children's Hospital, Dr. Ishatu Mustafa, for the past 3 consecutive years, the hospital has gone without any quarterly budget allocation.
Sees over 46,000 patients. Annually, we have over 14,000 admissions. As I speak, we are over the 13,000 mark for December, so you can imagine. So it's a very busy, this is the busiest hospital in the country.
It seems though that as a result of the overpouring population growth in Freetown, access to health is gradually becoming painfully strenuous, specifically at government health facilities. Therefore, a rapid multiplication of such facilities could be one potential antidote to the threatening health deficiency.
Here at the Oladuring Children's Hospital here on Frobe Road in Freetown. And from all what you've heard so far, it seems there is much more left to be desired in equalizing the health sector in Sierra Leone. So many issues, one being the insufficiency of medical drugs, and beds are scarcely insufficient, and of course coupled with the overwhelming number of patients who do come to these hospitals on a daily basis to be treated. SLBC, Eustace Victor Jones reporting.